Well, right now we're joined by the Chief Nursing Officer from St. Joseph's Health, Anne-Marie Chiz. Anne-Marie, thanks so much for joining us. Really appreciate it.
Thank you for having me.
So I think probably a lot of people know this, but unfortunately patients have not been allowed to have visitors at hospitals across New York State. So it's not just here, it's all over New York State. How difficult has that been on everybody, the patients, the loved ones, and certainly your staff as well?
Yeah, certainly. St. Joseph's has always had a long-standing history of seeing patients and loved ones as part of the safe healing environment for delivering patient care. So it's certainly been an adjustment. I've been very thankful, and the community's patients, caregivers, patients, all of our frontline clinicians have really done a beautiful job working to incorporate that in other ways, either through phone calls or remote monitoring or being able to FaceTime. So we've gotten through this, but it's certainly been a change that we're looking forward to when safe and best to move forward from.
I'm not sure. You're pretty busy, I imagine, so I'm not sure you get to sit and watch every single second of the governor's briefings. But today, when it comes up that they're going to have this pilot program to try and see if we can get visitation on some level back into hospitals. And one, I think, of only 4 hospitals upstate is St. Joseph's. Kind of what's the reaction there?
Oh, we're thrilled. We're so excited. It was over 10 years ago that St. Joseph's was one of the first healthcare institutions to open up visitation and include caregivers and family members as part of the plan of care for patients. And we believe that that's consistent with our mission, our vision, and values, and how to be able to carry that out. So we believe that the adherence and the high quality and safety standards that we've been able to see over many, many years has been able to have us be one of the institutions to pilot these guidelines and move forward with safe visitation. We're so excited. Sometimes
with these announcements, the details seem to be not as abundant right away when they come out. What are you learning about how this pilot program will work? I imagine that obviously it's not just going to be we open our doors and everybody comes piling in like we used to before. So what have you heard how this pilot program will kind of work?
Yes, we're very thankful because the governor's office provided some guidelines that are actually very consistent with all of our access to the hospital, ensuring that we have a screening pathway for potential visitors, that we have the available supplies and personal protective equipment, that we provide visitors with strict hand hygiene protocols, and certainly, as always, making sure that the patient and the healthcare team is in line with that visitor, caregiver, loved one, that's consistent with enhancing the safe healing environment to move their care plan forward.
So I'm imagining then like things that people will have to get into, maybe PPE, and I don't know if that's like full head to toe, what that looks like. Maybe are they temperature checked, symptom checked, those kinds of things when they first get to the hospital?
Correct. Screening does include temperature checks and ensuring that there's masks available for anyone who's entering the hospital. So that would include visitors, as well as understanding how to perform hand hygiene in the strictest way, because as we know, hand hygiene and good distance, as well as the available PPE, depending on the specific patient condition that a visitor would be present with, all of that factors in, but we know that those good protocols provide the safe environment to ensure that we protect ourselves and our patients.
Do you have any idea right now as to how many visitors that you'll be using this for? Is it going to be every single patient at the hospital, or is that not really realistic with a pilot program like this right off the beginning?
We know that the guidance provides us with evaluating the patients that are requesting this, and certainly the visitors, but being in a patient-centered environment, that's key to be able to hear directly from our patients and the healthcare team. And the guidance provides us that we would have visitation for a short or select period of time, and only 1 visitor per patient.
Okay. Anne-Marie Chiz, I know you're incredibly busy at the hospital. Thank you so much for joining us. Really appreciate it. Again, Anne-Marie Chiz, the Chief Nursing Officer from St. Joseph's Health. Thanks so much.
Thank you.